Health Education Lecture Series. All the listeners of Health Education Lecture Series, I'm your host, Gurdeep Singh Sandhu, homeopathic consultant. My clinic address is 9701 Sarah and Court, Dublin, California 94568. And phone number 408-687-1899. Email address homeomedicine HOMEOMEDICINE at yahoo.com. So, anytime for any disease, when you are tired of treatment, please call 408-687-1899 to discuss your problem and to take a second opinion. Or even if you want to get treated with the scientific homeopathic approach for your diseases, yes, call 408-687-1899. We are discussing about the life journey, how the life was created and how it was developing step by step. All these things we are discussing. And at this time, we have reached at the spot that when it is not adult, it's a pre-adult age. A person after coming out of mother's womb and passing through the new life, newborn life, added to the toddler's age, and then after toddler's age, he was passing through the adolescence age, and then the adolescence age has come to this point that it is considered as pre-adult age, when a person has not become fully responsible for his duties at this age, though he has been assigned for that one, but he is still not competent. He has not gone through that one, or you can say it is his initial stage to cover up the disease, to cover up the responsibilities and learn about the responsibility and discharge the responsibilities. And this way, that is why a section separately has been formed from the adult age as a pre-adult age. So pre-adult age means it's a type of you can say orientation, a type of orientation of the life when you are entering into an adult life and you are taking hold of the new responsibilities uh, just away from the parents, or even without the help of the parents. But you are still not competent. You have not gone through those things. You do not know about the complications, problems you will face at this time, but you are still carefree as you are under the shelter of your parents. And parents were taking care of you at this age. And at this age, sometimes due to ignorance, due to negligency, due to carefree life, you suffer from many of the diseases. And those diseases we are step by step discussing with you that sometimes due to diet, you do not care about your diet, you are carefree and you eat whatever you have that one. You are not specific for your diet, and you're not even uh, caring about what type of diet you need and what you are eating, all those things, and you eat whatever you get it. And under those conditions, you suffer from some of the digestive system problems, intestinal problems, some of the bacteria, some of the viruses, some of the things may enter into that and may complicate the conditions at this time. And just like we consider diarrhea, dysentery, IBS, irritated bowel syndrome, all these things, colitis, or even ulcerative colitis, whatever, and anything can happen. Anything. No, I have already told you about these things are not uh, related to this age group. These diseases may occur before this life and after this life as well, during the adult age. But we are taking it at the pre-adult age, considering and discussing about these diseases, is because the negligence, carelessness is more, much more than as compared to the early age, because the early age was taken care by the parents, and it's much more from the other future life, because at that time you becomes competent and you becomes aware of the things which can harm, which can deteriorate your health, and now you are avoiding those things. You are sufficiently intelligent that what can cause you sick, what can cause you in a problem. So you add those things, you learn at that time. But this phase we are discussing is that you are not competent to know about all these things, or even if you know about all those things, then you are carefree, and sometimes you suffer from these kind of conditions. The first thing I told you about that one is the obesity and anxiety, tension, because you are overloaded with the responsibilities. Previously, most of the responsibility was taken care by the parents, and at this time all the loads are coming upon you, plus your own responsibility, plus your own duties, whatever you have assigned for yourselves. So in this way, sometimes the anxiety comes up, and a person anxious all the time, person bored all the times, and person overloaded with work all the times, sometimes may go into depressions, because he feels help nowhere. Parents are already given up the things that now you are full responsible, you are grown up person, and you have to take care of your own responsibilities. And under those conditions, when parents say this thing that you are grown up now and now you have to take up your own responsibilities, sometimes it put pressures on the persons, and sometimes anxiety, tension, plus the day-to-day life anxiety, tensions, and everything is remains pending. Everything is not covered and done in timely fashions. That ultimately brings up a depression at this age. And after the physical type of things I told you about, the IBS, irritated bowel syndrome, digestive type of problems, all these things may come up at this age, if you are not taking care of your health properly, you are not taking care of your food properly, and under these conditions, a person may suffer from all these conditions at this pre-adult age. But after that, you learn it. When you face something, when you suffer from some diseases, ultimately you learn, and that is the adult age. But we are talking about the pre-adult age, that you are not sufficiently intelligent, you are not properly knowing what can cause to him, because previously everything was taken care of by the parents, and now it is your responsibility to take care of yourself. So therefore, sometimes you suffer from these kind of conditions. And then after that, some of the negligency or carefree brings up you the respiratory problems. And those respiratory problems we were discussing about yesterday, we discussed in the, I think it was Punjabi sections, we discussed about the bronchitis. And when you say bronchitis, the respiratory, any type of respiratory problems may come up from a simple exposure, change of weather, change of season, change of temperature may bring up some type of irritation in your bronchus, in your respiratory passages from nose to lungs. Suppose if you are in a room and there is a heat, and ultimately there is a cold outside, and you just go out of the room without taking proper care of your nose, mouth, ears, and everything. You do not cover everything, and ultimately you got exposures, and that exposure is not taken care properly, and ultimately it may go on. Or even if your immunity is weak, if your immunity is weak, this thing may go on increasing and increasing, and it is not covered in timely fashion as it should be in healthy persons. And then ultimately it is, doctor says, oh, you are having bronchitis. So bronchitis, we have already described you, it is the inflammation of the bronchus. Bronchus are the tubes which are inside the lungs, and which are responsible for exchange of gases from the blood to the outside environment, and to take up the oxygen from the incoming air through the nose to the lungs. So these are the, you can say, the roads for the transportation. This is the road of the transportation from the lungs, from the bloods, to take up all the gases which are not required by the body, which are toxic gases, are produced inside the cells by the functions of, and their routine functions, and ultimately they are released into the blood, and then blood comes into the lungs, and then lungs, they shed off all those gases. And by with the pressure of the outside environment, outside environment brings up a pressure, ultimately for 480, everybody know, millimeter of mercury pressure. 480 millimeter of mercury pressure automatically pushes the air in a normal way to our air passages, and it goes through the bronchus and ultimately to the lungs. And if those lungs are, those passages are inflamed, there is inflammation, there is a pain, there is a swelling, there is a narrowing of the lumen from where the oxygen is passing down into the lungs and going to each and every tissue, so that whatever blood is coming up there, it's shedding up of its carbon or other gases which are lighter than the oxygen, and the oxygen is heavier in a molecular weight, and that goes inside the blood, and that carbon dioxide and all other gases comes out being lighter and goes out by the respiratory processes. And if those passages are inflamed, that is called bronchitis. And that bronchitis may be on one side of the lungs, maybe of the both side of the lungs, maybe in the whole, as a whole respiratory processes, they are dry up, they are inflamed, they are red, and all those things can happen. All the symptoms are associated with this one, that is known as the inflammatory symptoms. And in the initial stages, there may or may not be cough, not be sputum, but ultimately the sputum, the flame, is associated with this one, and it's a painful type of condition when you continue respirations. When you continue respiration, they inhale or exhale, that causes pain, and that's known as, it's an inflammatory condition of the bronchial tubes of the lungs, basically lungs tree of respiration, and that causes pain. And this bronchitis is considered as the acute bronchitis and also a chronic bronchitis. Acute condition may come up due to the viral infection if exposure is there, and ultimately it is complicated with the viral infections that may linger on the disease, that may increase the curative periods of that disease, as in a normal way it should be recovered by your responses of your body, because all the time our life force is combating all these type of things which are coming from outside and causing injury to our life processes. And the life process is fighting with that one, and that thing is known as the normal process of recovery. And that normal process of recovery, if does not take place, if it does not take place, it means something has complicated with it. So in this way, it may linger on the process, and that is called acute bronchitis. Cold, cough, fever, pain during coughing, and all these things may come up with the acute type of bronchitis. And lastly, I have already given you an example of the acute conditions. All the acute conditions generally comes immediately, passes their course, and sometimes if they are more virulent and your vital force is not sufficient to bear that loss, then at that condition, that at that condition you suffer from this sickness. Some of the people are calling. I request you, please, when I'm at a program from 5 to 6 p.m. at California Pacific time, please do not call during this periods, and call me after that one, so that it should not disturb my lecture regularities. So we are talking about the types of the bronchitis. The one is the acute bronchitis, when there is a painful, and it may be infected and may linger on than the normal periods. Cold, fever, and it may be increased by smoking, by dust, or infected by the virus or the bacteria as well. Anything can happen ultimately with this one, because if the vitality is weak, though all the bacteria and viruses are surrounding in our environment, all the things are not affecting our body because our vitality is stronger. And vitally stronger vitality is all the time taking care of life, and it do all the bacteria, viruses which are accompanying in our environment, in our air we breathe in, and they do not harm our body. But when our body becomes weak by some or the other reasons, when something else comes up, just like the exposure I told you, the vitality becomes weak, and sometimes these kind of viruses, bacteria may invade, may come into this processes of the disease, and may complicate the disease, and the disease symptoms are increased. So this is what I told you. In the initial stage, there is a dry cough, there may be pain when you breathe, and ultimately, if it's complicated, their fever may come up. And all these conditions of the acute bronchitis are increased by the dust, by the smoking, and if it is complicated. Okay. So the other condition we have discussed about the chronic disease. Mostly the definition of the chronic diseases is that these come slowly, pass their course regularly with our life processes, and ultimately, but one thing I forgot from the acute diseases, about the acute diseases, I want to tell you, these comes like a storm. Storm comes and goes. It's a limited period. Just like we tell I always tell about each disease that it has incubation period. Incubation period, when a person is infected, but still symptoms are not there, then it is known as incubation periods. And when symptoms starts producing, the vitality start expressing this thing that I'm in pain, I'm having some type of problems, and it means the disease is taking its course in our system, and causing disturbances in the normal flow of life. But it has a limited period, limited course and times, and after that it will go if it's not complicated. If it is not complicated with any bacteria or virus, it will go and complete. I give you the examples of the even this COVID, or even simple flu and all that one. They have their normal period of 3 to 7 days, and ultimately they go off. But if the viral infection is invaded into that, causes the complications. And the viral periods, we have already told you about that one. The incubation period is 4 days, and after that 4 days, if it is not existing, it goes off and everything is cured. But If it is complicated with the virus infection, then it may go up to 21 days, means 3 weeks. And ultimately, within 3 weeks, it is covered. Within 3 weeks, it is covered, and there is no need of any medications. If your vitality is stronger, and then it will take care itself by these type of conditions. But if the vitality is weak, it may be infected, it may be complicated by viruses or by bacteria. And when it is complicated by the viruses, we know the period of the viruses is 21 days. And after that, it will go. But one thing we must remember, that it does not mean that after 21 days there will no symptom of the disease. There will be, because just like after the storm, you have the damages of the electric poles, damages of the trees, damages of many other things. A storm comes and it has spoiled many of the things. Then to recover all those things, it will take time. And whatever damages a infection, viral or the bacterial, has caused inside our body, to the different type of tissues, to the different type of tissues. And now it comes into practice that each and every tissue has its own specific period of repair. Storm has gone. We know that after 21 days, there is no such type of things if it is not complicated. And ultimately, whatever damages it has caused to our system, what type of tissue it has damaged inside our body, now the recovery will depend upon those. How long it will take. Just like many times I have an example, if the mucous membranes are damaged, it takes normally 3 to 7 days to recover. But if it is not recovered within 3 to 7 days, then it means we have to find out the reasons behind that, because why they are lingering on. Just like a person is having a fractured bone, and doctor says, okay, you will have to, we will plaster you for 6 weeks. Why they say 6 weeks? Because they know the recovery or the repair of the bone will take about 6 weeks. So that's why they tell me. So it means, if any infection has come up, any infection has complicated your simple things, exposure and all that things, and has damages to different kind of tissues. If it's in the intestines, it is causing damages to the different kind of tissues. If it's in the lungs, it is causing different kinds of tissues. So if it's in the bone, it has a damage to the different kind of. So it depends upon what type of organs and what type of tissues are damaged by this infection. This storm has come. Storm has come. What type of damages it has caused? Now the repair will depend upon the damages. What type of damages we have? The same thing is in our body. What type of tissues are damaged? It will depend upon that condition, that this kind of tissues are damaged inside our body, and the repair of these type of tissues will take this and this time. We know, as a pathology, this is a subject of pathology. In pathology, we know that that's the course of the disease. Pathology tells us the course of the disease means, if this kind of tissue, there are four types of different tissues in our body, and all the body is composed of cells, and cells are of different type of cells. When joined, they form the tissues, and tissues, when they form different type of tissues, they form organs. And when the different organs unites, and they form the systems. In this way, whatever has been damaged inside the body by any exposure, by any type of disease, ultimately the recovery depends upon that. Because, and if ever anybody asks, doctor, how long it will take for me to recover? So doctor is not a astrologer. No, he will tell you according to the study of the lab, according to the study of the pathology, that what type of tissues are damaged by your exposure, by your disease, and the repair of these type of tissues takes this much time. And he will tell you, okay, it will take you this and this time. But sometimes, doctor, you told me it will be recovered within 21 days, but it is not. I'm still having problems. Still having problem means those tissues, in the way of repair of those tissues, there are some hurdles. And then we find out those hurdles, those complications inside the body, why these tissues are not repaired normally. So, okay. After that, the second type of bronchitis is the chronic type of bronchitis. When you say chronic type, when you mention chronic in any disease, it means a process of the disease is traveling with your life force, is traveling with your body, and it will continue and will continue run its course slowly and will go with you. Ultimately, it will go with you. It will not go before that. Chronic conditions, they are running their course. But acute conditions, yes, they are recovery periods and they will recover in a short periods. Ultimately, sometimes some of the damages caused by this acute conditions may remain for a longer period. If a bone is broken and you are having limping gait, lifelong you have to do that. Yes, you can maintain that. Nowadays there are many more means in the medical science that you can maintain that, but ultimately if there's a broken bone, means it will go with you. But that's not disease, that become part of your physics. Whereas the chronic conditions are the damages of organs to such an extent that their function is harmed, that their function does not remain normal. In the same way, if we say chronic bronchitis, it means with acute infections. Ultimately, it was complicated with bacteria or with viruses and all that. And ultimately, they have damages. Just like the storm has damages, the trees damages has the walls, even some houses have fallen with the storms and all that. Then sometimes it is not repairable. It is not repairable. The same way, we are talking about the bronchitis, and we are saying that the bronchial tubes are inflamed, which is recoverable. But when these damages are of such an extent which is not repairable, just I can give you an example. The first change, whenever a tissue or a cell falls sick, becomes sick, that is known as inflammation. And every inflammation has some different signs: pain, redness, heat means temperature, immobility. And that organ is unable to move freely, move painfully. So all these things are the signs of inflammation. So in the acute condition, whatever the disease may be, these first signs comes into existence, that if he cough, he feels pain. And the movement of the lungs is not normal, because movement, what the function of the lungs? To exhale the air and inhale the air. This is the function. And this function is not normal. Plus, it creates heat, tension, because nature is sending more blood to that area to recover, to take care of all these processes. That is why there is heat. Basically, when there is a temperature in any disease, we think it's a good sign. Good sign means nature is taking care the disease itself, taking care of that one. That's why there is a heat. It's fighting with the external infection. That is why there is a heat. So these are five signs in the initial stage of acute diseases. And the second stage, that is known as degenerations. Then what? If there is a damage, if there is what we do, if there is a damage after the storm, we try to take off the fallen trees, we try to take off the fallen poles, electric poles and all that what has been damaged, to take it away, so that a thoroughfare or the way should be regulated, the road should be clear to walk on that. So in this way, the second stage is known as degeneration. And ultimately, the degeneration is resolved when all the damages is taken care of. When all the damages are taken care of and the roads are now clear, you can walk on. This is the process. It means in the stage of degeneration, it is still recoverable. It is still recoverable. We can repair it. We can go in normal smoothly after that. But the third stage is that when sometimes it has damage to the extent that no, we cannot repair this road. No, we cannot repair this line, electric line, or we cannot repair this pipe, and we have to make the new pipe. Ultimately, that type of damages when a local area of any organ in any disease, in lungs, in heart, in liver, in any intestines, wherever any disease is, when it reaches to the third stage, that during the disease processes, part of this organ has been damaged to the extent that it cannot be repaired. Storm came, it damaged to the extent that now it is not repairable. We have to do something new. Just like people do bypass surgery. What they do, they think that the blood vessels which were supplying the blood circulation to the heart are damaged to the extent that they are not repairable. So then we make a bypass. The same way, when in any organ, when in any organ damage is of the extent that it is not repairable. When it is not repairable, then we try to manage an alternative route, surgery. But if it is not possible that you can do surgery at that conditions, then a narrow passages, a narrow way of passing through from that damaged area is constructed by the nature if life is progressing. If there is a death, no question. But if this life is still going on, suppose in the bronchus, we are talking about the bronchitis. Some of the bronchus, after damages, are there was ulcerations. After the ulceration, some of the tissues are contractures. They are uniting together, are making the nerves more thin. The lumen of the bronchus tube is now constricted. It is not allowing the air to pass in the same way as it was previously before the bronchitis. So, in this case, ultimately, lifelong, we have to do that one unless we do something alternative to manage these conditions. And the third stage, when not only a part of the organ, but as a whole, an organ is damaged, that no, it is not workable now. Or you need to deliver transplant. You need to kidney transplants. You need to do this and that. Whatever, when the doctor says, no, this organ has been damaged to the extent that it is not repairable by any means, and with this damaged conditions, it is not possible to run the life. That is known as chronic conditions. Chronic conditions. And this transplantations and all that one is the management. It's not, basically the cure is that how the nature has formed our body, and we are repairing this body, and this form remains the same as the nature has made us. But if we change the form, it means we are doing something alternative. It means it is not according to the nature. You are maintaining the conditions according to your demand. So all those conditions, when a doctor says, no, we have to replace the organ, we have to do the bypass surgery, we have to change the organs or transplant the things, then it means the condition is a chronic condition. Whether or not you are able to do that transplantation, whether or not you are able to adopt all those measures, ultimately, if you are surviving, if any patient is surviving under these conditions, it means nature itself, nature itself is creating, is trying to function, to continue the function of this or that organs to the minimum quantity. And when you live with the minimum quantity of function of a organ, then that is known as chronic disease. In any organ, when the function of the organ is damaged to the extent that it cannot be repaired and it cannot fulfill the sufficient quantity of function, just like the bronchitis, it is not giving us the sufficient air which is required by the body, but it is still working. It is still working. Now you have to manage your functions. Suppose if this condition comes in the bronchitis in the lungs and somewhere, then ultimately you are just running to the stairs and coming down and going up, no problem. But now it will be difficult for you to run, go upstairs, ascending, descending will be difficult for you, because the excess of air, excess of respiration, excess of circulation is required to go upstairs and downstairs, and that is not possible because sufficient oxygen is not provided to the heart. Sufficient oxygen is not provided to the heart. It means heart had to work more to provide the sufficient oxygen. If he was palpating to 72 to 80 per minutes, now he has to go 100 and more than that. Palpitation, tachycardia. If if you have to go upstairs, then the heart will palpate more, because normal oxygen, the quantity of oxygen which is required to go upstairs is not provided by the bronchus because their function is damaged. But nature itself is trying to provide some of the quantity of the air through those same passages, same bronchus, if there is no alternative. Ultimately, nowadays surgery is advanced, and we are doing many things to repair all, just like the bypass surgery I told you, just like replacement of the kidneys, just like replacement of the part of the liver and all that. We are doing surgery is advanced nowadays, and it's a miracle that that how long you have to survive, you can survive with full strength. Lungs, if something has been changed, it means now the oxygen was not able to go through the normal process and in a normal quantity, but now you have done something, you put something into that, ultimately the air going in a normal way, it means you have managed that. In this way, all those diseases which are at that extent that either you need to manage artificially the function of that organs, or if you are not able to manage those things until you do not get the doctor, or you do not have the means to do the surgery or transplant of kidney or liver or what else, under those conditions, if any person is surviving, he is surviving with a minimum quantity of that function of that organ. Whatever organ is damaged, their minimum quantity, he is being supplied in his function, and whatever he has to give to the life is a minimum. Lungs has to provide the oxygen, it will provide the minimum. So this is what I want to explain you, that there are two forms of the diseases: acute diseases and chronic diseases. We were running through the phase of pre-adult age, and that pre-adult age, when you are carefree, when your parents are not taking care of you, and parents say that no, you are grown up child now, you are going to be adult now, you have to take responsibility of that, but you have not learned everything. You were learned it from the experience. Ultimately, when you will suffer from any problems, ultimately for the future life, you will learn this thing, that oh, I suffer from this thing. If I go barefooted outside, if I go uncovered from in the cold sides, then ultimately you will take precautions for that. So this is a type of orientations, you can say. The pre-adult age from 20 to 35 years of age is considered the pre-adult age, where you are passing through an orientation of the life. What type of condition you will face in your life, you are passing through the orientations, and within the orientation do many things wrong. You do many things wrongs, and when you do many things wrongs, negligency, carefree, everything, then you have to suffer that. You will broke something, you will make damages about that one. That happens. So this is what this we are talking about the lungs, that what you do negligency under these conditions, then you may suffer from the bronchitis. And the bronchitis are having these types. So as per the symptoms are concerned, yes, respiratory function is a painful. Inspiration and expirations both are painful. There is a short breathing. You cannot take a deep breath. If you take a deep breath, forceful air will go and come out. Ultimately, there is a swelling inside the bronchus tube. It will cause pain. That's why. And sometimes with the bronchus, people keep their hands. You will see the inspections. People are, when they this breathe or when they cough, they keep their chest protected. Or sometimes some of the people with the acute type of bronchitis, they catch their throat, because this air passage is passing through the throat inside, and that is painful, that is swelled up, and ultimately when the air passes you feel pain, so you protect it by hand. So bronchitis peoples in acute conditions try to protect their neck, try to protect their chest when they cough. They hold the chest when they cough. So these are the signs and symptoms. And when a doctor checks all these things, he feels wheezing, a wheezing type of sound, as if something, you can say, thick solutions, and you are breathing through a thick solution. There is a flame inside, but that flame is not that lubricated that it can come out. In the initial stages, in the acute conditions, it's a swelling. It's a swelling. Flame has not yet formed. The flame will be formed in the next stage. When the flame will fall, ultimately it will come up when you cough up, and that is the resolution, which is, I told you, the third stage. After the acute conditions, inflammatory stage, degeneration stage, and the necrosis stage. Now those tissues are diagnosed and they are becoming the flame, then they are coming out. And ultimately, the surface will be repaired by the nature itself. It takes time, though it is complicated things in the bronchitis, that when the flame starts coming, it is the third stage, but it is the resolution that you should be, you should think that, yes, now I will recover. But if it is not complicated, if you are taking proper care of you, if you are taking proper medications for that one, so that the raw surface from where the scrapings of the flames and all that are coming out should not be further complicated by the bacteria. So these are normally the pain, sore throat. Sometimes if cough is irregular, if cough is frequent, if cough is spasmodic, then sometimes people feel fatigue. They sit down, they cannot stand, they cannot walk during the cough. So they feel fatigue. So fever is only when it is complicated. So that is the sign. And so all these signs are the symptoms of the bronchitis. Acute and chronic, I told you, the chronic is a stage when nature itself is not sufficient, the organ is not performing its function normally, whatever it should be. So that is known as the chronic condition. Means some of the organs, some of the inner lumen of the bronchus has stuck with each other, and the lumen has become a narrow from where the air has to pass. So it means it causes a different kind of condition that is known as chronic. And after that, another thing which a person can suffer is known as the pleurisy. About pleurisy, I would like to tell you all the organs inside the body, either liver, lungs, heart, all the organs mainly are covered by a covering, just like the abdomen. Intestines are covered by a covering that is known as peritoneum. The genital organs inside the lower abdomen, male or female, whatever, they are covered by a covering that is known as broad ligament or the lesser sac of peritoneum. Same way, the heart is covered by a covering that is known as pericardium. Peri means before that, before the heart, pericardium. And a covering upon the lungs is known as pleura. And all these coverings which I named you, all these coverings are double layered. One is external layer, and the one is the internal. Or one is attached with the organ, the other is external. These two types of layer, but they are sticking together. There is a small fluid that when the organ moves, it should touch to the other side of the layer, but there should be a fluid. There should not be any friction side of noise. There should not be any friction. Lubrication is there. So that pleura is covering to both the lungs. And sometimes, because of these kind of exposures or because of any bacterial infections, when it is complicated, the normal things, now it is complicated and all that. So ultimately, what happens? These layers are inflamed. Pleura, a covering on the lungs, on both sides. Lungs, it may be on one side, or maybe on both sides, but these coverings are inflamed, and that is known as pleurisy. There are two conditions of this thing. Pleurisy has two type of things. One is dry pleurisy, the other one is wet pleurisy. Dry pleurisy means that fluid which was in between the layers has dried up, and when you breathe, lungs inflamed and they touches to the other sides, it causes a friction and pain. Mostly, just like breathe, and that layer, that the two layers of the pleura comes together. But when you exhale, they are separated, and that friction causes pain. That is known as dry pleurisy. That's very painful. That is very painful because there is a friction lungs continuously, because we breathe 14 to 16 times per minute. We breathe 14 to 16 times per minute. It means regularly there is a expansion of the lungs and squeezing of the lungs. And with these conditions, ultimately it causes pain. And that's a painful condition. The second condition is the pleurisy, that is known as wet pleurisy. When that fluid is increased in quantity, and mostly this type of condition happens in the lower base of the lungs, lower portion of the lungs. It's not hard and fast fluid, but it will get mostly this fluid comes in the lower portion of the lungs, because fluid normally goes to the downwards. And ultimately, if this fluid is increased and then it presses the lungs, it is taking that gap in between the layers filled with fluid. And now we cannot expand our lungs during the expiration or inspiration. When we take inspiration, our lungs are flattened, but there is no space. There is no space. And if there is no space, it means you cannot take deep breath. Then you will see, if a person is having bronchitis, he will take a short breath, not long breath. Short breath, even if it's a dry pleurisy or even it's a wet pleurisy. But the difference between the two is there is a specific type of pain you feel. We heard by the stethoscope that a specific type of pain in the dry pleurisy is there. If it's dry, it's very painful. But if it's wet, it's not painful, but you cannot expand your lungs totally up to the, because I told you there is a total lung volume. That is the maximum capacity of the lungs, which can be inhaled. Inhaling air, what maximum quantity of the lungs can go inside the lungs? That is known as the total air, total lung capacity. Then the tidal air. Tidal air is the volume of the air which actually goes out, comes in, goes out, comes in. We play with that quantity. That's the tidal air. With our respiration is, suppose if is 1 liter air goes out with the expiration, 1 liter air goes in with the inspirations. That is known as tidal air. It may be different quantity in different persons. And the residual volume. Residual volume is that it is not that when you exhale, when you expire, take a expirations of the respirations, that the whole air from the lungs has gone out. No, then the lungs will collapse. That is why the nature has maintained a condition so that the total air cannot go out of the lungs and some of the air remains inside. And that air is always mixture of the external environmental air and mixture of the air or the gases which are coming from the blood into the intestines, into the lungs, which is collected from all the tissues, from surrounding of the bodies. It has collected and ultimately it has come to the lungs, so that all the gases can go out and all the oxygen can be taken up by the hemoglobin of the blood, and then it go back to the circulation. And at that time, because there is a residual portion of the air, some of the air remains inside the lungs, so that lungs should not collapse. It should remain still dilated to a limited extent. And that air is known as residual air. And the residual air is always a mixture of air, oxygen, and the carbon dioxide. Remember, we say for life we need oxygen. Not at all. Not only the oxygen. Yes, the major portion of the oxygen is required by the cells for the functioning. But if there is no carbon dioxide, it cannot inflame. They cannot work. It means the ratio of the carbon dioxide is required, and that type of percentage in the mixed air, that's the residual air in the lungs, remains over there. So we are talking about the pleurisy, and the pleurisy, wet pleurisy, is not that much painful, but even then, the total lung capacity is reduced. Total lung capacity is reduced. Therefore, a person cannot take a deep breath. Not painful. When it is a painful, that is dry pleurisy. But when it is not painful, but short breathing, in dry pleurisy, a person take a short breath and catch hold of his chest or the throat because it's painful. But when there is a wet pleurisy, he cannot take a deep breath, though there is no pain, because the lungs are not having that much space to expand, because the surrounding layer is filled with water, filled with fluid. And that fluid may be in simple interstitial fluid, that fluid may be complicated with blood, that fluid may be complicated with pus and bacteria. This is another condition that whenever I will go to the different section of the diseases, then I will explain you what type of complications may come up in the pleurisy. Now we are discussing only the complications which a person may face at the pre-adult age. This may come up if he is not taking care of his life, of his day-to-day life properly as he should be, because he's learning, he's passing through the learning period, orientations. That's why they suffer from this kind of conditions. And after that, a condition comes known as the asthma. And I think today's time is going to be over. I will not be able to explain all this about the asthma. We will discuss it tomorrow. But tomorrow, the time is for the Hindi lecture, because as you know, all these lectures, we are delivering 1 hour lecture every day. And one day it's Punjabi, one day it's in English, and the other day it's in Hindi. All the three languages I'm covering, so that anybody who understand Hindi, who understand Punjabi, who understand English, can understand what I'm saying, and he can follow the journey of life, how the journey of life is passing through, and what are the diseases and complications he is suffering from. So all these things we have discussed today is the pre-adult age and complication because of the ignorance and because of the negligency of the persons, or being carefree from his protection of his body, but still his immunity is weak. His immunity is weak, is not sufficiently stronger that he can protect, or he can be saved from any draft, cold or hot or anything, but he suffers from that one. So these things can come up. And ultimately, when we have discussed about the bronchitis, and we have discussed about the pleurisy, and next we will discuss about the asthma and pneumonia, because all these things are step by step coming up. If this bronchitis is not covered, it may go to pneumonia, it may go to the pleurisy, or it may complicated by the tuberculosis even ultimately, if it's not taken care properly and it's not recovered in due times, it may be complicated with tuberculosis as well. So we will step by step, what comes next, what come next. So first thing we discuss the bronchitis, the simple thing, the first thing which comes up in the respiratory system is the bronchitis, then the pleurisy, then the asthma, and then the pneumonia, then this one, the tuberculosis. All these things are systematically, if they are not taken care of one by one, all these things may complicate your life. So you have to be careful at this age. Whosoever is passing through the age of 20 to 35 and have overburden of his day-to-day life, and is carefree and do not know about how to take care of his body, how to take precautions of his body, he should take care of all these things. He should learn these lectures so that he can understand what his responsibilities are. About your job is a different thing, but first of all, how to take care of your body is a must. If you have a healthy body, definitely you can do your work normally, but if the body is not healthy, you will not be able to perform your duty whatever are assigned to you, and ultimately it will create an anxiety, and anxiety will come to the depressions. So, to save all these complications systematically, you have to watch all these lectures later or sooner, from YouTube, from Facebook, or from Sabrang radio station, anything, from anywhere. You can watch these lectures regularly so that you can learn all these things, if may happen to your life. And if ever anything happens, you should be able to protect yourself from those things, or you should be able to take care as a treatment for those things. So, Rabrakha, God bless you all. We'll see you tomorrow. And tomorrow is the time of the Hindi lecture about all these things, pre adult age. Every time, because I'm not reading it from any books, whatever is in my mind, every time my words are different. But the content, whatever actually content I want to explain you, is the same. Whatever we have learned in the medical colleges and what I have taught in 26 years in medical colleges, that is the same. And since about 30 years in I'm delivering all these lectures regularly so that everybody from my community, at least, they should learn about all these things, what can happen, how it can happen, and even the dreadful diseases you should not suffer if you take care properly your life from beginning onwards. So, Rab Rakha, God bless you all. We'll see you tomorrow in Hindi lecture. And I'm your host, Gurdeep Singh Sandhu, homeopathic consultant. My phone number is 408 687 1899. Email address homeomedicine at yahoo.com. HOMEOMEDICINE at yahoo.com. Anytime, if ever you are having any problems and you want to discuss and you want to take second opinion about that one, you can call me at 408 687 1899. Sat Sri Akal, Adab, Namaskar.